Hello, everybody. At the outset, I would like to thank the organizers for giving me this opportunity to share with you all the exciting future of the medical sciences. Why is there a sudden increase in the pace of medical technology? It's because various technologies are getting integrated. There is digitalization, there are the smartphones with their apps, and the human genome has been mapped. There are advances in various other fields of medicine, and with globalization and with the world shrinking, there is a need for optimizing time. And finally, there is enthusiasm for good health, longevity, and better quality of life. So then the future is actually beginning now. So few of the things that I intend to discuss are XR, that is extended reality, which includes augmented reality, virtual reality, and a mix of these two, precision medicine, artificial organs, 3D printing, implantables, wireless brain sensors, and various other advances in medicine. XR or extended reality, as I've told you, it's a mixture of virtual and augmented reality. It's very important, proving to be very important in medical teaching and training. And there are some studies that have shown that the performance of the surgeons has increased by over 230%, and they are able to perform the surgeries 20% faster. XR also allows complex surgeries to be done easily, and it's being used for treating psychiatric conditions like post-traumatic stress disorder, anxiety, autism, and phobias. It's been used in pain management and patient education also. Another interesting thing is empathizing with the patient. So it gives the caregiver an experience of the age-related physical instability, tremors, etc. I've always wondered, see, we have patients like, for example, pain. Patients describe pain differently. So but we know that a cutting pain is different, a colicky pain is different, a dull aching pain is different. So what the patient tells us may not be matching with what we think they are telling. So is there a way that we doctors can experience the patient's symptoms, so that we can understand the disease and we can make a diagnosis better? So could this be a future of extended reality? Precision medicine or personalized genomic or genomic medicine. This is a very interesting field. You can see the picture on the right side. There's a patient population, and if this patient population has a disease, the standard approach is give the same treatment for all the patients. So it may not be effective in majority of them. Whereas if you categorize the patient according to their genetic data, the genomic data, the clinical factors, the environmental factors, maybe you can tailor make their prevention and treatment strategies. The benefits are that we have a huge database and specific and more effective therapy, better diagnosis and understanding and research and integration of health record. But the challenges are the data collection, the cost, and then privacy and confidentiality issues, ethical, social, and legal issues. Then artificial organs, there's definitely a need for artificial organs because all the organs can fail, and so if you find a replacement, especially if you can make an artificial organ, then probably we would be able to save many lives. So the artificial organs are human made organ devices or tissues, and they have to interface with the living tissues, and they should be on their own, like they should not be attached to a constant source of electricity or any kind of power. power, and they should be able to perform the mechanical, biochemical functions of any organ. So right now we have the artificial limbs and cochlear implants and bionic eyes, and also the elastin and collagen nanofibers can be grown as scaffolds in case of cartilage or bone injury. So this is again another very interesting and exciting field. Then the 3D printing is going to revolutionize medicine in many ways. Like if we have a 3D bioprinter, as I told you, we can print artificial organs, and already we have the medical implants and prosthetic limbs. 3D printing can also be used for learning and surgical training, and more importantly, as I have previously told, precision medicine, that you can print out the medicine in any way you want, as a syrup or as a tablet or a sheet or something chewable like that. And also assessment of toxicity of medicines can be done on printed tissues. So you don't have to use the animals for assessing the toxicity, and it definitely opens up a huge market for the cosmetic industry. Implantables, cochlear implants are already being used, so it helps those people who are even very hard of hearing right from birth. And bionic eyes, they have a 3D printed light receptor with silver ink particles and photodiodes that convert light to electricity. These two cochlear and bionic implants I've shown in this picture. And also you can just imagine having an under the skin updatable chip that holds your medical records, and it may also be able to do your blood tests. So what, as and when you go to the doctor, all your medical records are getting updated into the chip. And finally, ingestibles, again as precision medicine, and ingestibles have also been used in foreign body removal, especially in children, and to patch up the tissue that has been damaged because of foreign body ingestion. Wearables, this is another fascinating world. Imagine wearing a smart contact lens which has a biosensor for blood sugars, and it may even detect some cancer cells. You may have Fitbit like devices to monitor your vitals and predict imminent dangers. And more excitingly, you will have a digital tattoo. It just looks like a tattoo, and then that holds all the information like the under the skin implantable. And promotion of gamification by insurance companies, this is another big way the wearables are coming, and I'll shortly tell you how. And abdominal patches to record uterine activity in pregnant women and detect preterm labor. And there's a condition called sudden infant death syndrome, so they're using this digital eye and baby cam to keep a watch on the baby and also its breathing. And in preterm babies, they have used wearables to detect the brain activity of the preterm babies also. Brain computer interfaces. This is another fascinating field, and this creates something called cyborgs. Cyborgs are cyber organisms, and here you can see the Kevin Warwick, Neil Harbison, Jesse Sullivan, and Stellark, who have sort of gelled their bodies with computer, and so they are using their brain as the interface. Like you have this Neil Harbison here, who has implanted a receiver into his skull. So he is color blind, but he can actually hear the colors, and he is even made melodies with colors. And then retinal chip for perfect eyesight, memory chip for limitless memory. So this is just the beginning of cyber organisms. And then, what are the pros and cons of future technology? The advantage is that it optimizes time, manpower, travel, and maybe costs eventually. And definitely, there's better diagnosis and precise treatment. The flip side of that is, of course, ethical, moral, and social issues. And we may be able to diagnose very rare and new diseases for which there may be no solution. And this, the whole idea will be defeated if this happens. Finally, I would like to give you a glimpse of one day in future. You replaced your old medical tattoo to that of your new pet's picture. It has run some tests this morning because your breathing was heavy after the stipulated exercise. The insurance company will increase the premium if they know you're not sticking to your exercise schedule. So you have to exercise. You finish a round of online VR session to overcome your phobia of heights that the tattoo detected when you were dreaming last night. By then, your test reports are ready. The cholesterol and some biomarkers are abnormal. A prescription has already been sent to you, and you have to bioprint it to your desired formulation of either syrup, capsule, or tablet after making the payment. Just then, the smart contact lens receives an ad about increasing your lifespan for about 5 to 6 years with a unique therapy. You smile and pat the artificial kidney that has stuck to your side since 8 years. Smile again and ask it, what do you say? Thank you.